And we were given a challenge in collaborative work with NHS England and Improvement to improve the patient experience of diagnostic test results in a completely understandable way. Question 7, National Cancer Patient Experience Survey. In a new survey is question 8, if you are interested. So we decided, okay, let's challenge ourselves and start to understand where we have a problem. So we look at National Cancer Patient Experience Survey results, and what we found. Largest participant in survey is a breast cancer patient for our hospital, and also breast cancer patient is only pathway that we completely own at King's College Hospital, i.e. it's our local population, and we have full oversight and responsibility for pathway. So we looked what results looking like, and that's what we've seen. There is definitely disparity between ethnic diversity population and a white population. As you can see, however, at that point, we didn't know who is our ethnic diverse population. We have come back to PICA and asked if they could help us with understanding the data. We went to our outcome team in a hospital, and what we found, that digging out and find out that breakdown was more difficult than doing whole project. So data collection issue, you probably all know, is really requires improvement. I think that a lot has been done in each hospital to improve this. But without understanding who the population we're looking at, really difficult to improve care, because obviously we're all not the same, and one approach not going to fit all. So we really need to hear from right people, like we heard today. After a lot of digging and almost 3 months spent on this, we have found out that in 2019, for whole year before COVID, is what we decided to do, because 2020, I don't need to remind you how difficult that year was. We found out that at our Camberwell site, King's College Hospital, yes, Denmark Hill, Camberwell site, most representative population is Afro-Caribbean population. However, at our Princess Royal Hospital site, which is at Bromley Orpington area in London, it is more Asian. So we have this diversity. We then contacted each person you see on the list and asked them if they would be happy to talk to us. And actually, it's my colleague Shola who done this work. And what we found that people really appreciated personal touch or meeting. Some people didn't want to talk on the phone, so we might needed to meet with people. And they were really happy to share story. They wanted to know as well how we going to share this story with others. And some of them was then happy to participate and work with us when they understood what we were trying to achieve. So we changed the question to target our population, but also what we found, people were not really interested to talk about actual, if they understood diagnostic tests, because they actually were so much expert by the time when we were 2021 interviewing them, that they could tell us each diagnostic test in such details, I think we didn't even understand them. But what they wanted to talk to us is how they made feel at the time they were experienced going through diagnostic pathway. And therefore, we completely changed the question. And our project team had to come back to NHS improvements and patient experience team to actually say that we're going to change the question. And we had a lot of debates, but they were very flexible because they understood that if we are focusing on experience, we're actually going to answer the question. So never doubt if you're guided by the patient that it will be the right thing to follow that lead. So you can see that we had a really wide stakeholder engagement, but in the center of everything we were doing were our patients. And actually our 2 patients who co-designed everything we produce in this film, and ladies who informed what we done, they were really instrumental in guiding us what is important to them in receiving end of a care they're experiencing with us. And I think this is a key message to take forward. So I will pass now to my colleague.
Following on from what Irina said, we spoke to 30 of our breast cancer patients, one of whom is with us today and a member of our projects team, and we've managed to chunk their feedback into 3 major themes. So the first was around care and compassion, and we had almost all of our respondents comment on the care and compassion they received at the point of receiving their diagnostic test results. The second theme was around the experience of care, or the wider experience of care. And one of the things we found is how difficult it is to really speak to patients, like Irina said about one small aspect of care when patients really want to talk about how they felt at that particular point in their pathway. And the last theme was around communication and information. And the good thing there was that's a theme that's been consistent around the wider programme of care around patient experience at King's. So following the feedback, we've pulled together 5 change ideas which we've fully implemented now. The first was a breast care flow chart for diagnostic tests, which basically explains what patients can expect from the moment they're referred into the service, who they'll be seen by, what types of diagnostic tests they'll have, and how long they might have to wait. And we've also developed an easy-read version of that leaflet as well. We've updated the urgent suspected cancer referral letter to include more information about how long patients might have to wait if they've been referred into the one-stop clinic. We've changed some of the language on our breast care unit web pages just to kind of soften it up a little bit. Older versions of the web pages made it seem like if you were referred into the breast care unit, you would almost must have cancer. So we've kind of softened that up a little bit. We've added hyperlinks to other nationally recognised sites on breast care as well. We have included the presence of our breast clinical nurse specialists in our urgent suspected clinics for patients who are having a biopsy. And last of all, we've developed a staff training video, which I'll show you at the end. So, as you can see, we've looked at the feedback from the most recent National Cancer Patient Experience Survey results for 2022, which came out just, I think, a couple of months ago. And as you can see, just at the top box, we've made quite a significant improvement from 2019 in both of the categories for people from white backgrounds and people from from Asian backgrounds and people from black and minority ethnic backgrounds as well. I won't go through all of these, I'll just pull out a couple. So in terms of sustainability, we have presented a number of the change ideas at different South East London Cancer Alliance meetings for breast and also other tumour groups such as colorectal, head and neck and lung. And we're continuing to use the National Cancer Patient Experience Survey results and our own local patient real-time feedback surveys to be able to monitor the changes that we've made. And then we have also been instrumental in some of the changes I've mentioned around changes to our breast care web pages and also to the communications around the letter that we've used for patients. And I'd just like to show you now. So I mentioned the staff training video. We've taken all of the feedback from the 30 patients that we've spoken to, and we've pulled together the themes that our patients told us about how they felt whilst they were receiving their diagnostic test results. But mainly the theme is around how sort of a focus on the cultural awareness and cultural diversity and sort of maybe some of the cultural, unconscious bias that patients felt at that particular point. And we'd like to share a 3-minute version of this video with you.
Co-production works on the principle that those with lived experience are best placed to advise on what services should look like in order to make a positive difference to their lives. Our patients told us the following.
As a black woman, I am aware that if I ask too many questions or try to advocate for myself, I am perceived as pushy and aggressive. I work hard at suppressing my voice. If I'm labeled troubled, my fear is that impacts adversely on any future medical care.
I felt they didn't listen to me. They ignored me. So I stopped trying. I told my white British friend what had happened to me. She was shocked. She told me I should have found my voice. I have a voice. I tried to use it. They just didn't want to hear me.
English is not my first language. I am scared. I am afraid. Please take your time to understand me and check that I have understood you.
I know they are very busy and important people, but sometimes they don't have the time to listen to me. I worry I take too long for them.
I'm coming to you at the most vulnerable time of my life. Please, treat me with care as well as care for me.
When you ask me, if I need an interpreter, a family or friend with me to make sure I understand what you are saying. I know you are working hard at helping me.
Please don't use script with me. Look at me, engage me, see me.
After the consultation, the breast care nurse rang me to go over all of the information again. This time I had my sister with me, so she could help me understand what they were saying.
I would like to go to the support group, but I will not understand what they are saying without an interpreter. I'm not allowed to take anyone with me, so I lose out on what I need.